Australia is a nation of sports lovers, but like most developed countries around the world, the majority of its population does not engage in sufficient levels of physical activity that will enhance health and well-being. In 1999, the Australian government rewrote a set of guidelines about recommended levels of physical activity. A healthier population brings many advantages to a nation. People are more motivated, more productive, are less likely to suffer conditions like heart disease and diabetes, and they enjoy better mental health. It also assists governments to keep health costs down. The National Physical Activity Guidelines are a series of recommendations about levels of activity for three demographics: children aged 5 to 12, adolescents aged 12 to 18, and adults.
What they're there for is really to give a guide to adults, to children, to adolescents, to what should they be doing in terms of activity in their daily lives, how much should they be doing, what they should be doing, and why they should be doing it.
There are 4 general guidelines. The first is to think of movement as an opportunity to improve health, not an inconvenience. The human body was designed to move, but today's technology has resulted in far less physical activity being required in everyday life. Consequently, we have developed a mindset that has seen people become physically lazy. The prevailing attitude is that we minimize our physical activity rather than maximize it. Many people regard physical activity as something that is done only when absolutely necessary. Their lifestyle is such that exercise is avoided as much as possible. But this first recommendation is that our attitude should be one that looks for opportunities to exercise whenever possible.
Well, I guess our activity is determined by not only our own sort of genetics and our own desire to be active, but also the environments in which we live. A good example now is that it's very hard to find stairs in big buildings, so you use the elevator. So that's sort of building design. We know that in new areas, for example, where they're not building footpaths, that if you don't have a footpath outside your place, then you're more likely to be overweight. We know that if you live on a freeway, you're more likely to be overweight, much more likely to be overweight than if you don't.
The second guideline is to be active every day in as many ways as you can. This recommendation encourages individuals to incorporate physical activity into daily activities by making choices such as walking or cycling for transport as much as they can, and doing things for themselves as much as possible rather than using labour-saving devices. Examples include taking stairs instead of elevators, getting up to switch appliances on and off instead of using remote controls, and doing your own household chores rather than paying people to do them for us. The third guideline recommends that individuals participate in at least 30 minutes of moderate intensity physical activity on most, preferably all days. Moderate intensity exercise isn't vigorous, but does raise breathing and heart rates. Examples include brisk walking, playing ball games in the park, digging in the garden, or moderate-level swimming and cycling. The fourth guideline is that people, where they are able, should enjoy some regular vigorous activity for extra health and fitness. Examples of vigorous activity include playing a game of tennis or squash, aerobics, basketball or football, circuit training, rowing, power walking or jogging.